Hello, everyone. Good afternoon. So today we're going to present to you our topic. The group agreed to discuss with you healthcare ergonomics. And our members are Kamryn, Deanna, Joie, and myself, Vibelle. So we choose ergonomics, particularly the healthcare ergonomics. Let's define ergonomics. This word is a Greek word which means ergon and nomos, which means the study of people and their working environment. It is essentially the laws of work. And healthcare ergonomics is the science of fitting the physical and cognitive demands of the job to the worker to prevent injury, human error, and improve worker and patient comfort. The goal for this healthcare ergonomics is to eliminate discomfort and the risk of injury due to work. In addition to ergonomics, the goal of this is to eliminate and discomfort also and the injury. Ergonomics basically is the laws of work. For this slide, Dina, can you please read and discuss the first question?
Musculoskeletal disorders are injuries that affect muscles, tendons, ligaments, and nerves. The injuries can develop when the same muscles are used repetitively or after a long period of time without any adequate rest. And this type of injury increases if the force is exerted and the job requires an awkward position. So some examples are back, neck, and shoulder pain, carpal tunnel syndrome, and tendonitis. MSD can decrease productivity and the quality of one's work and product and services.
Thank you for that, Dina. And for this slide, Kamryn, can you?
Yeah, so the primary risk factors for MSD are forceful exertion, which is basically the force is the amount of effort required to perform a task or job. The more force exerted, the greater the stress on the body. So an example of that would be like lifting, pushing, pulling that you require to exert force or your muscle effort. The next one would be awkward postures. So posture is the posture of your body parts. Awkward posture occurs when joints are held or moved away from the body's natural position. So some examples of that are, again, stooping, like bending over, kneeling, or reaching overhead. The next one is repetitive movements, which is pretty much self-explanatory. It's just when movements are performed over and over again to cause a repeat. Secondary risk factors are gloves, which indicate like wrong size can be a risk factor for this disorder if they do not fit properly or if they restrict movement of the fingers and hands, or the temperature, which is heat and cold. They can affect the muscles. Cold temperatures increase the stress placed on soft tissues by reducing the range of motion and flexibility. Heat affects the work's rest cycles required due to the increase in fatigue and the need for muscle recovery.
All right, thank you for that. And how to prevent work-related MSDs. LJ, can you discuss this to the group?
Okay, there are two controls that we can use to prevent work-related musculoskeletal disorder. First is the engineering controls. Engineering controls are measures taken to physically modify the forcefulness, repetitiveness, awkwardness, or vibration levels of a job. Examples of this includes modifying the workstation layout, selecting and using tools and equipment, work materials, and work methods that will reduce MSD risk. Basically, these examples basically protect workers by removing hazardous conditions or placing a barrier between the worker and the hazard itself. The second one is the administrative controls. These are management and directed work practices and policies that reduce or prevent exposure to risk factors. Administrative control strategies include changes in job rules and procedures, such as more rest breaks, job rotation, and training. If you have proper training, it will basically reduce the impact or severity of a hazard because at least you know what to do. Next,
Exactly.
why is manual patient handling so hazardous? Based from the word itself, it is manual. So it requires an individual to exert a force or effort. For example, push, pull, lift, or carry that can cause high level of stress, injuries on the bones, joints, and tissues of the back, neck, hands, wrists of, for example, a healthcare worker. Injuries associated with manual patient or resident handling that can cause nurses and healthcare workers are permanent disability, chronic pain and suffering, shortened careers, loss of livelihood. It creates a negative impact on patient safety and clinical outcomes, and it is extremely costly for healthcare organizations.
Thank you for that, El.
Okay.
Next slide. Dina, can you please discuss this?
What should employers do to ensure healthcare workers' injuries can be avoided? First, we can have policy change at the workplace, such as zero lift policy, more short breaks, and job rotations. Purchase and implementation of new patient handling equipment, such as overhead lifts or floor lifts, and training on the new equipment and on patient handling.
Thank you for that. And next slide. So for the analysis of the case study, the work-related MSDs are the leading occupational health problems, and also this is the occupational health problem that can cause life-altering career and disabling and chronic conditions to nurses and healthcare workers, such as aides, the orderlies, and attendants, PTs, the health aides, and emergency medical workers. Injuries caused by repeated manual lifting, transferring, and repositioning of patients and residents. Exactly, these are the common problems that can cause MSDs. MSDs are the most prevalent injury among healthcare workers, true. We discussed that earlier. And nursing aides, attendants have the highest rates of musculoskeletal disorders because they are the ones handling the patients in the healthcare environments, in the nursing homes, hospitals, and home settings for the emergency medical services. In conclusion, we also have these suggestions. We come up with the suggestions for improvement of preventing the musculoskeletal disorders for healthcare workers. So first, ergonomics makes the job easier and productive. Employees assured of safe, hazard-free workplace by using or implementing healthcare ergonomics in the workplace. And employers should train the employees to recognize the unsafe working conditions. We should, healthcare workers should recognize first their safety and the condition of their workplace. And lastly, ergonomics can make the employees feel valued and increase their productivity. This is true when everyone or the employees are using ergonomics. They feel valued and their productivity increases. We believe that ergonomics can make our job easier and productive, along with the satisfaction and assurance that our workplace are safe from hazards and risk factors. Injuries and disorders related to ergonomics are the growing category of the work-related illnesses, and it is beneficial for the employees to be trained also to increase awareness of the factors and recognize and avoid unsafe working conditions. Attention to ergonomics can make employees feel valued and more likely to be engaged and more productive. And lastly, with the proper body mechanics, healthcare workers can be able to work effectively without using excessive energy and without hyperextending muscles and joints, avoiding musculoskeletal disorders. So that's it for our presentation today. And these are all our references. And before we end, let me share with you a safety quote from Robert Pelton. Tomorrow is your reward for working safely today. True, right?
Yes.
Yeah.
You will have a bright tomorrow. So that's it for today, ladies, and thank you for participating in our presentation.
Thank you.
Thank you.